Welcome to the Besties with Breasties podcast. Sarah Hall here. I am a certified health and wellness coach, athletic trainer, mom, and breast cancer survivor. I help women overcome their own mind drama to make mind shifts that open up the possibility for their most empowered and energetic life.
And I am Beth Wilmus, author, speaker, and founder of a human investment organization, otherwise known as a nonprofit, called Faith Through Fire. Our mission is to reduce the fear and anxiety that breast cancer patients feel and replace it with hope and a path toward thriving.
This podcast is about our experiences with breast cancer
and life after as young survivors and moms.
Dude, it's so early.
We started a little early this morning.
It's early.
We're both kind of measuring how much our brain is functioning based on percentages. I'm at like a 60%.
Ooh, you're doing good. I know. I asked Sarah this morning, I said, how's your brain working? Because this is what I don't want to forget today. And I feel like I'm working at half speed.
You know, I also, maybe I'm just going to blame it on this, but I feel like being on the hormone therapy has made me want to sleep more. I used to be kind of a morning person, and now I'm like,
oh, really?
I'm more of a late
Actually, now that you're saying that, I think you're right. And today's gray. So that didn't help either. When the alarm went off at 5, I was like, it's dark outside. Yeah. I'm not ready for this.
We also still have little kids that come into our bed. And there's just something about, don't roll your eyes at me. There is just something about cuddling a little person in the morning that makes me not want to get out of bed.
Really?
Yes.
Oh, I cannot stand to cuddle.
Oh, I like to just wake up to their little snores.
Oh, okay. Well, you're a better mom than I am.
No.
I'm like, get out of here. Like, I need my space.
For the most part, during the night, I don't want them to be in there, but it's in the morning. They usually come in at like 5 o'clock in the morning or something, so it's not like the whole night.
You have littles, though. Your kids are younger than mine.
Yeah.
Mine are getting to that age now where they actually enjoy sleeping in. So our guest is on the East Coast. That's why we're doing this earlier.
Yeah.
So anyway, we are excited because today another survivor named Allison is going to join us to share briefly her breast cancer story and her experience with having a hysterectomy and oophorectomy after she was done with treatment.
Yeah. We're going to start with, what Allie's doctor's recommendations were for surgery. And then we're going to talk about what her recovery was like and how she felt after her hysterectomy and her oophorectomy.
And then we'll wrap up with what life is like now and what she wants others who are considering surgery to know.
But before we go into all of that and talk with Allison, let's hear from our first sponsor.
Hair loss is consistently ranked as one of the most feared side effects of chemotherapy treatment. The emotional impact chemo hair loss can have on patients has been well documented. Scalp cooling is a simple treatment that can prevent hair loss caused by certain chemotherapy drugs. The use of scalp cooling is proven to be effective in preventing chemotherapy-induced alopecia and can result in people retaining much of their hair. Paxman is the global leader in scalp cooling. Their cold cap is scientifically proven to reduce hair loss during chemotherapy. If you are facing cancer treatment and concerned about losing your hair, ask your provider about scalp cooling and visit our website at www.coldcap.com. Hi, Allison. Welcome.
Hi, thank you for having me.
Thank you for being here. We started the conversation saying that this is early for us here in St. Louis, and I said that you were on the East Coast, but you're actually not. You're in Florida, right?
Yes.
But that's still Eastern time.
Barely, but yes.
So you're an hour ahead of us, so it's not quite as early, but still early for you as well.
Yeah, it's almost 8:30.
Yeah. There you go.
Are you? We were kind of talking, right as we got started. Are you a morning person?
Not necessarily. I function better if I get up early, but it's just making myself do that if I don't have to and I don't have the structure.
Yeah.
Well, you have kids, right? I feel like kids make you have to get up early.
Yeah.
They do, but so I follow their schedule. So I'm kind of rolling out of that summertime schedule into the school time schedule. So it's a transition, but I'm actually adjusting just fine.
Yeah, there is something about school time structure, like of your day. I don't know. I enjoy a structure where you have to get up at a certain time.
Do you?
Yeah.
I the best part about summer is that I don't have to get the kids up for school.
Yeah.
The best part of school is that I have an entire day to get stuff done.
Yeah.
That's true. They're out of the way.
Yeah.
Right. Well, let's dive in, Allison. Sure. When were you diagnosed with breast cancer? What was your official diagnosis and what was your treatment plan?
I was actually diagnosed on my 37th birthday.
Oh, great.
So that was, I know, I felt so bad for the nurse.
You felt bad. You felt bad for her.
That had to give me that news. But she did, I will say, she made it sound way more positive than it was. She said, oh, it's just going to be like a little bump in the road. More than likely you have, low grade a lower grade tumor, and it's early in the treatment. It is estrogen positive, HER2 negative, which is a more treatable tumor. So, you're probably going to do some estrogen therapy. She didn't really, I think, prepare me for everything that was going to happen. So I don't know looking back if I appreciate that, because it wasn't as overwhelming at first, but it was, as I went through all the treatment and they kept kind of adding things to it, it was like, well, I thought this was just supposed to be a little bump in the road, and my mom had a very, very, very small tumor that was found early when she was in her late 40s, and she took tamoxifen for 10 years and did really well. So I thought that was all that I was going to have to do. They recommended no question about it. Go ahead and get the double mastectomy. You're young, there's may as well get both breasts.
Oh, interesting.
Was there chemo and radiation involved?
I ended up having multifocal breast cancer. So I had 3 lumps when they went in. They didn't show up in the initial ultrasound, but they showed up in the mammogram. They didn't show up in the mammogram, but they showed up in the MRI. I think it was an MRI. And they were real, real close to the chest wall. And then my other one was kind of closer to the armpit. And when they went in to do my mastectomy, they were going to do that first before chemo, because it wasn't a super fast growing tumor. It wasn't very large. They just wanted to go ahead and get it out. And then they looked at it in there and they found out that it wasn't very much in the lymph nodes. Maybe it could have been a micromet, but they weren't sure. So, at the time they weren't recommending radiation. But then when the pathology came back, I did have to meet with the radiation oncologist. And she did say to me, there was a micromet. It was really, really small. I can't remember exactly how small, but it was like 0.2 millimeters, or I forget the exact terminology, away from recommendation for radiation. She said, I know. So she said, if you go across the street, I was at Vanderbilt in Nashville. I was living in Western Kentucky at the time, and I received excellent care there. It was a dedicated center. That was all they did. I felt very confident in the advice that they were giving me. And she said, I really don't think that the negative impacts of the radiation are worth the potential risk. So I opted not to do radiation. But my Oncotype score, I believe it was 22 or 23. I can't remember. And my oncologist did recommend chemo. So I did Taxotere and Cytoxan.
Oh, you and I had like the exact same treatment plan.
Oh,
yeah.
Yeah. So it was like, what was it, like every 2 or 3 weeks?
Yep. I think it was every 3 weeks at 4 rounds. I opted, yes. I was really borderline too. And so opted to not do radiation. So yeah, you and I were very similar.
Oh,
we had almost the same Oncotype score too. We're like That's cancer twinsies.
I was just going to say, you guys are breast cancer sisters.
Yeah. Well, I'm interested to hear what you ended up doing. I did the chemo. It was manageable. You felt kind of crummy for a week, and then you kind of had those couple of weeks to bounce back a little bit.
Yeah.
So I didn't think it was terrible. I was definitely very tired and didn't feel great, but I managed it, and it's a distant memory now.
Yeah. Right.
Yeah. Because how long ago was this for you?
So, that's a good question. I believe it was the fall of 2018. Yeah, that would make me 40, right?
Yeah, we are. Yeah, it sounds like we're just a couple months apart, because I was diagnosed in February of 2018. So
I'm curious. This is in 2018, and then you just recently had a total hysterectomy.
I had it in January of 2020, so right before everything locked down.
Oh, right.
2 years after your diagnosis. Did your doctor bring this up to you, or did you bring it up to your doctor? How did that conversation start?
That's a good question. I was at Vanderbilt, and it was after my chemo treatment. I was going back in, so I think I finished around September or October. And the oncologist recommended that because I was so young, she recommended that I do the tamoxifen. That was what they had said initially. I do the tamoxifen for the next few years. She wanted me to wait until I was 40 because I was young and married, and the tamoxifen was more manageable than this other treatment that was coming up. And it was something that they had been learning about in these trials. I believe it was the text and soft trials.
Okay.
And this was a newer recommendation where they were finding a 6% greater protection against recurrence in
this
women
with the aromatase inhibitor and the ovarian suppression?
Yeah.
Yes. But the man that I met with said that he didn't really want me to be on the Lupron injections for very long because they were seeing that it was causing bone density issues quicker than having the ovaries removed.
Okay. So is that when he brought up having your ovaries removed?
Yes.
Okay.
And how did you feel about that?
It was at first I didn't really think it was going to be that big of a deal. I did a little bit of research, but not a lot of research, because at that time, and I still do ultimately feel like I had to make the decision that was going to give me the greater chance for longevity, especially with 3 younger children.
Sure.
And I couldn't really, I don't know. It weighed so heavily on that end of it that I was afraid to even consider, any reasons not to, because, I had my oncologist telling me, I had him telling me, it's, and he did say if you were my wife, and he was a younger man and probably in his late 30s, early 40s. And he did say, if you were my wife, I would definitely say you should do this. But he did say, and I noticed that you said hysterectomy. I did not have to have a hysterectomy. He looked at all my history and all my, he looked at my blood work, genetic testing and all that, and determined that I wasn't at risk for cervical cancer or uterine cancer or anything like that. So he said he did not recommend having everything.
So your genetic test came back negative. Did you have genetic testing and it came back negative?
Yes, I did the 23 panel, the panel that does all 23. Nothing that they know of.
Yeah,
right. Nothing they know of now.
Well, and Sarah and I should clarify this. Dr. Lynn, when she was on our podcast, said this a couple times, but I think it's worth mentioning again that your uterus doesn't produce any hormones. Yeah. So having your uterus removed is not going to have any kind of side effect to it, like having your ovaries removed. Removed. So
when you take your ovaries, you take your biggest supplier of your body's estrogen,
right, and progesterone and testosterone.
Right. Yeah.
So I mean, that's where it's all happening, is in the ovaries. Yep. So you didn't need to have your uterus removed, but that's really not where you see the side effects. You see the side effects with the ovary removals. So your doctor recommends this basically just because he didn't want you to develop osteoporosis on the shots. He thought that the chance was less by taking the ovaries out. And so I want to kind of talk about what recovery was like for you and how you felt afterward. But before we do that, do you guys want to do boobs in the news?
Yes.
Let's do boobs.
Sure.
Allie, you want to do boobs in the news with us?
Yes, I'd love to.
Okay. Boobs in the News is where we read funny tweets from real people or ridiculous news stories.
Boobs in the news, boobs in the news, boobs in the news.
Okay, so it says, so when you need drunk food and the restaurant isn't open, you can always turn into this guy. So there's a guy who broke into Denny's in Indiana around 2 a.m. when it was closed.
Oh, my God.
They headed straight into the kitchen and made themselves some eggs. So apparently, going to the 24-hour grocery store wasn't good enough. After they were done, they left. But when they went back again then at 3 a.m. and they decided they were still hungry, so they made more eggs. So during their second trip, an employee showed up who was, I guess, getting ready to open up for the day and chased them off. So the estimated loss was $1 whole for that Denny's. But it just kind of shows you that you should definitely be open 24 hours, Denny's.
Oh my gosh. That's what I was going to say. Isn't Denny's open 24 hours?
Who chances that twice?
I'm going to go out on a limb and say that there's more than alcohol involved with that decision making.
Probably.
They're being kind when they said he's just drunk. I think that dude was like
more than likely
maybe doing something else because that is some really poor decision making.
Yeah. Yeah.
That's bad.
How would you know how to work the whole like fry table at Denny's and everything? I mean, they have a whole big kitchen set up. Like I would be intimidated by that kind of kitchen in that state of mind.
So in college, I was a big Denny's fan. Like that's where we would end up.
Well, that's what I was going to say.
Yeah.
We probably just wanted to use the...
Yeah. Yeah. Like college was like, we had a country kitchen and we had a Denny's and that's where we would end up, for our 3 a.m. snacks because they were open. So like the Moons Over My Hammy was my go-to.
Jeez. We were big Waffle House people.
Were you Waffle House?
Yeah, we called it the Waha.
The Waha?
Yeah.
Anywho,
right,
that's the boob. Boob.
That is a boob.
Bibs in the news. Bibs in the news. Bibs in the news.
So let's kind of talk about how did you feel after you woke up from surgery?
So I think it was 3 teeny little holes, like 1 in the belly button and 2 on the sides. And they went in laparoscopically and took them out. Obviously waking up from anesthesia is always kind of a little difficult.
Touch and go.
Yeah. So I did have that issue because they have to inflate your stomach. I did have that painful gas issue where your chest hurts if you stand or you sit a certain way. So I kind of had to lie horizontally as much as possible. I did read afterwards, this would have been helpful, that some women had relief with either Beano or Gas-X. I don't know. I was like, I don't know how that would work because I thought that was a gastrointestinal drug, but supposedly it works. But
so we've talked to a few women now that said the same thing. Like when they had the surgery, they woke up and they were fine. Like they actually, some of them were saying, oh, wow, this was really simple. And they were walking within a couple of days. And then they started noticing symptoms, maybe a week or 2 later. Were you similar in that way or was it different for you?
I don't recall having any symptoms later. If I'm being honest, I have a really hard time also differentiating between what could be side effects of the aromatase inhibitor and side effects of actually having the ovaries out because I kind of took them both at the same time.
Okay.
So, you were suppressing your ovaries and then you stopped doing that so that you could take your ovaries out. And you're saying that for you, the symptoms were very similar. So it was hard to see where one started and the other stopped. Is that what you're kind of saying? Okay. That's really interesting because some women were taken by surprise because they thought it was going to be exactly like the shot and the ovarian suppression. And then for them, it was more severe. But you're saying that when you did it, you felt like it was kind of par for the course, very similar.
Yeah, I mean, well, the gynecologist did say that since I had been, he said, some women do well with it, some women don't. He said, since you seemed to fare well with the injections, you will probably more than likely have a similar response with the ovaries.
And that was your experience?
It was mine, luckily. Now, long term down the road, and that's where the kind of I try not to think about it. I try to kind of pray that they come up with easy solutions to these long term issues that we're supposed to have. The heart issues, bone density, the brain, functioning, all the things that happen to women as we age that are now coming tenfold
Sure.
to me. And obviously I've noticed already visible signs in aging in my skin and, my joints. And I definitely feel older.
Yeah, I think the aromatase inhibitors that I'm on definitely have aged me. And I call it the cancer look because I think you can tell. Maybe not at first, like when somebody first starts on it. But then over time, do you think you can tell?
Yeah,
Sarah?
I think your skin just does look like I hate to be like a little bit wrinklier, and
I get jowly,
and you
I've got like little
Yeah.
jowls now.
You hold lines a little bit more, and your skin looks drier, and it just doesn't look like that youthful like glow that you have, where it's like,
I'm so glad you said that about the jowls because I was doing my. Sometimes I will sit at my table and use one of those little mirrors that kind of zooms everything in. And I was doing that in the natural light because I was like, I just want to sit down. Sometimes you want to like sit down to do your makeup so you can actually, do a good job. And I was like, what is going on right next to my chin. And I hate to be superficial, but I think it's important.
Hey, listen, we've been through enough. We don't need some jowls at the age of 40, right? Like I was ready for the jowls when I was turning like 70, not freaking 40. So I think it's okay that we're not happy about it. That's my, two cents on that.
You know, it's so funny. I actually just did some research and ordered this facial exercise book and improve your jowls. And
well, you know what? You need to do some before and afters on that, Allison. And if that works, then we'll be talking about that on the podcast.
I will send it to you. Hey, anything to help out other women going through what we're going through, because it's just it's one of those things where you teeter between like, yes, I'm so happy to be alive because I know so many young women that don't survive this terrible disease, and I know that we have things down the road that we have to look for. But it's like, in the meantime, though, can we have some quality of life? And I'm all about trying to figure out how we do that.
Yeah. I think I'm hopeful that the medical community is going to start spending more time on quality of life, because women are living longer with this disease and managing it longer. And so I think they're realizing that, hey, they do have to live their lives. And so I'm hopeful that they're starting to do that. So on that note, have you had any side effects regarding like the procedure that you're, kind of managing yourself now?
So absolutely. Joint pain, fatigue. It's hard to know if the brain fog is from being a mother and coming off of chemo or whatever, but definitely there are issues, there are vaginal issues that a lot of women deal with.
I think pretty much all of us. All of us, whether you're on ovarian suppression or whether you've had your ovaries removed, I think the painful intercourse is like the biggest deal. That and lack of desire, right?
Yeah. Oh, absolutely. And there absolutely is lack of desire for sure.
So one of the things that I was kind of interested in talking, so you and I, when we were chatting offline, you actually have participated in a clinical trial, right? To address that issue? Or did I get that right?
So that's a good segue, because you were talking about the medical community taking interest in quality of life. And I can tell you that without a doubt, the gynecologists and other doctors at the Mayo Clinic are very much interested in that. And, a particular gynecologist that I'm working under in this study said she was just so disheartened by all the young women that she has that come, and not only young women, but older women as well, that come in and they have these symptoms, and the traditional route that women that are going through menopause take is estrogen therapy and hormone therapy and hormone replacements. And we can't do those because it creates a greater risk for recurrence. So she found this study in France, and I cannot recall the name of it, but they took a bunch of women and they did this platelet-rich plasma therapy, where they draw your blood, they put it in a centrifuge, they pull out the plasma, and then they do multiple injections actually in your vaginal wall. And what it does is the plasma is the part of the blood that brings in all those platelets, and it helps heal areas. So the theory is that it will kind of help heal and rejuvenate that area. But now I do want to make a distinction, because several women and there's lots of great resources, and Facebook is one of them, because there's lots of groups where women can share their stories with each other. And a lot of the women on the Facebook group that I'm in say, oh yeah, I've heard of that. It's the O shot. And it's not the same. The O shot is it is the same technology, but it's very, very minimal amount of plasma, and they only do like one or two or one. I think my gynecologist said it was like 1 to 5 shots in a very targeted area that is meant to increase chances for orgasm. So like the G spot. Think targeted area.
Yeah.
Versus 30 to 40 shots that
all
are
around the opening,
around that basically improve the entire area.
So you offered to be part of this clinical trial. Was it painful?
Sort of. So, I'm not going to lie, because I don't want to discourage anyone from doing it, because for me personally, it was absolutely worth it. Of course, my symptoms weren't as bad as some women. Some women have their vaginas have already like closed up, and they're having to use the dilators, and mine wasn't quite that bad yet. I had been using the Ovary hyaluronic acid suppositories, having great results with those, absolutely worth every penny. to get on the monthly subscription for that. And also, topical stuff, daily moisturizers and then lubes during actual intercourse. But this treatment, so they bring you in, and of course I brought my headphones and was listening to like calming, soothing music, like trying to just go to another place, but they did numb it topically. So I wasn't supposed to actually feel the needle go in, but when you get a shot and you just kind of feel that
pressure
medicine, that pressure. Occasionally I did feel some pressure, but it was temporary. And all in all, I think it took like 25 minutes maybe for the entire, to get all those shots, so that she went slow enough that it wasn't super painful, because she would do, I think, 7 different locations and then 5 shots in each location. Kind of like, think of a clock, 5 at 12, 5 at 2, 5 at 3, all the way around. But once they did that, I had very, very, very little spotting, and it was a little sore.
Was it just a one and done? Did you go in and have that done like one time and then you were done?
So yes, I went in and had that done. I'm, I think, about 3 months out now, and I'm still seeing some of, the positive effects from that. I do have a friend that owns a regenerative medicine company, and she does PRP for a living. And she said that that in other applications, think elbow, knee, other areas of the body, typically you see results wane at about 6 weeks, and that you need at least a refresher. And she said some people see, the benefits for forever, but some people need to go back in for a touch up. But
when people have done PRP for like joints, to like,
can you guys explain what PRP is for people?
So
who
PRP
don't know?
is the platelet rich plasma.
Okay,
so it's just the acronym for platelet rich plasma. It's hard to say over and over, which is why they've acronymed it. But you can get it done for your joints to like rejuvenate like your labrum or, any kind of torn. It's a different option over surgery or them cutting something out. So if you just need that extra little oomph there, but from the research that I know about it, sometimes it takes like a year for that to fully heal, when it's in a joint and it's something a lot bigger, but I'm sure it's shorter timeline.
Here's my guess, guys. This is my guess regarding this procedure and everything else that's out there. I bet it is one tool in a toolbox of tools that you're going to have to do in order to kind of get like a cumulative effect, right? Yeah. Like there's as much as we want one thing,
a quick fix
to be like, this is the thing that we do for this and it works 100%. I just feel like, I think it's so interesting and good that they're pursuing these things, because we need something. Yeah. We need lots of things.
Absolutely.
Well, and this is going to fix the feelings and maybe apparently help you like orgasm and have the feelings of everything be better, but it doesn't touch your drive. It doesn't touch, it's like, again, it's just it's a part of the puzzle.
Yeah. But I think it's amazing that the Mayo Clinic is taking an interest in this and trying to bring procedures like this to women for their quality of life, because now here's a question. Is that covered by insurance?
See, that good question. And that's part of the problem with regenerative medicine. And it is not covered by insurance. Of course, I got it for free because I was a part of the trial. And if anyone lives near a Mayo Clinic and they want to contact the the oncology or gynecology department there to see if they're doing this, they're always, I have the impression that they need more participants.
Sarah, you want a road trip?
Yep, we're going to Florida.
Road trip. Well, no, Mayo Clinic's in Minnesota.
There's a few,
right?
There's one in Rochester, and I believe there's one in Phoenix.
Oh,
I think. Don't quote me on that. Well, of course, I guess so. You could quote me, but Jacksonville Mayo Clinic is phenomenal. I absolutely love it. If anyone lives anywhere near here, But the problem with the study is that you have to commit to multiple checkups in order to participate. So it's not like you can't just say, oh, okay, I'll go and do the one injection. You have to go, for preliminary exams, and then you have to come for follow-ups because, they're measuring, they're taking data, qualitative and quantitative. It's a whole
Yeah,
it's a whole thing. It's
you're
a
part of a
commitment.
study, and they've got to
Yes.
gather all their data to make sure they can help others better. So
here's the $1 million
Yes.
question, Allison. With everything that you've been through, and it sounds like it's been through a lot, but you've handled it fairly well. Do you have more peace of mind regarding recurrence now that you've had this procedure? Are you glad that you did it?
Ultimately, yes. There are definitely days where I worry that I made a mistake and that I wasn't going to have recurrence anyway. And I've ruined my quality of life, and I've possibly created, the potential for harmful side effects down the road. I'm doing everything I can. Mayo, again, they're great. I had a visit with a cardiologist. They measure my bone density once a year. I take vitamin D for that. I take fish oil for my heart and my brain, and other supplements as well. But there's things you can do to help mitigate those potential effects. But I think ultimately, if I had to do it over again, I would make the same decision.
Okay.
So,
all right.
Is there anything that you want women to know when they're contemplating, whether or not to do this procedure? Because there's some women who are going to feel like they really have no choice because maybe their genetic testing comes back and they're BRCA positive. And so they know that it's super high risk. And so, once they're done having children, they're going to have to they don't have to. Clearly, they don't have to.
Yeah.
But a lot of women that have the BRCA gene decide to go ahead and have their ovaries removed. But some women are like yourself and like Sarah and I, we don't necessarily have the gene. And so we're trying to make that decision. Is there anything that you want women to know, to talk to their doctor about before they make this decision? Is there anything you wish you would have considered, or just any last advice?
I think I would definitely talk to your doctor about all the long-term side effects, including the bone density issues, the issues with your heart, issues with your brain and your cognitive function. And, if you have other underlying conditions that would exacerbate those symptoms, or, I don't know. I think there's a lot of things to consider, and your doctor would definitely be the person to help you figure out if it's worth it.
Is it fair to say this, Allison? I think this is how I feel. And I think a lot of other women feel this way too, is that if I know everything there is to know, then I can make a decision that I'm confident in. I think that's why Sarah and I are
good, bad, and the ugly. Like
right.
Everything.
Because that fear of recurrence is real. And, especially when you have young kids, you really do make decisions based on wanting to be there for them. And so I think that a lot of women are going to choose to do this anyway for that very reason, right? Like this is going to be, I'm going to take this hit because I want to, increase my chances of being here for my kids. I just think that most of us want transparency and we want a game plan. So it's not enough for me personally to say, well, some women do well and some women don't do well, and we'll just cross that bridge when we get to it. It's like, well, if you're a woman that does not do well, here's what we can do.
Yeah.
Is that too much? Is that too much to ask? I feel like, I don't know.
I don't think it is, but I think that sometimes and especially when you deal with oncologists, I think their ultimate goal is, and I'm not saying that oncologists are bad, oncologists are amazing people, but I think that you have to realize that each doctor has a specific goal. And I think with them, their goal is to keep the cancer from coming back. And so sometimes you have doctors that sort of neglect to be completely transparent about everything that's going to happen because they just want you to, it's not that they don't care about the whole person. It's just that they kind of compartmentalize that into their goal is to keep the cancer from coming back. And maybe they kind of skimmed over all these other things that are going to happen. So,
well, and they don't know that they are going to happen. So for like you, for example, like you having your ovaries out was very similar to having the shot and the ovarian suppression. For other women, that wasn't the case, but for you, it was. So I think a lot of doctors are like, I'm not going to lead with the maybe. Yeah. Right. You know, if you transition well and you do well with it, then there's no reason to, cause fear. Right. So I think it comes from a good place, but I definitely, I'm a girl that needs a plan. Yeah.
I need to know like that there's a plan if
plan B,
if the bad happens,
plan
like
B.
If the things that they don't want to happen, so before we wrap up for today, let's hear from our second sponsor.
SSM Health is a proud sponsor of the Besties with Breasties podcast. 1 in 8 women will be diagnosed with breast cancer during their lifetime. Early detection is key, and keeping up to date on yearly mammograms could be life-saving. At SSM Health, we offer patients in the St. Louis area online scheduling for mammograms, including next-day appointments. Visit ssmhealth.com/schedule-mam to make your appointment now.
Okay, and we're back. So, Allison, we are really thrilled that you were with us today. Thanks for sharing your experience with everything that you've gone through and your decision-making process. I think it's going to help a lot of women.
Oh,
so we're happy to have you.
Wonderful. I hope so.
Next time, we're going to talk to another woman about her experience with surgery. And this is a fun fact. This guest is our very own Sarah Hall's mom.
Woohoo. Yeah, until next time, guys. See ya.
If you are a breast cancer survivor and you love Besties with Breasties, make sure you join our survivorship support network at faiththroughfire.org to gain access to exclusive episodes that are ad-free and uncensored.